Healthcare professionals and advocates are gathering in Grand Rapids this week to reimagine the future of inclusive medicine. The Reimagined Healthcare Conference takes place this Friday, May 1st, at Grand Rapids Community College with the goal of breaking down barriers to care and advancing inclusive medicine. There's a lot to cover. Joining us to break it all down, we have Jenny Knight and Doug Booth from Grand Rapids LGBTQ Healthcare Consortium. Good morning to both of you.
Good morning.
Thank you for being here. Appreciate it. Absolutely. Jenny, let's start simple. What is Healthcare Reimagined, and how does this conversation matter not just to providers, but to everyday people?
Well, Healthcare Reimagined is really focused on the frontline staff. So the front desk person, the schedulers, medical assistants. And our goal is to empower them to be able to ask questions and look at things differently so that the experience for the patients that they interact with gets better.
That's always what we're looking for, right?
Exactly.
An improved experience between the patient and the healthcare professional. Doug, there's a lot of change happening in healthcare policies, lately. How does this impact, say, the doctor, the nurse, the social worker?
Absolutely. Well, at the end of the day, the providers are really trying to be there to help their patients. And right now, there's been so many conflicting changes around what they can and cannot say, what they can and cannot provide. And so, this conference is really going to provide them some of those tools to ensure that the patients have what they need and that the providers really don't have what we call moral injury. It was often used with like military aspects, but we're finding more and more research that shows, when these providers have these policies coming down that says they cannot provide what they need to do, they have that internal conflict. And so, we're really trying to ensure that there's a wide toolbox that they can use to really bring that forward.
Excellent, Doug. And I think what you're talking about, can be encapsulated in the word trust. It feels like you want to be able to trust who you're talking to and the information that they're giving you. So how might this conference help rebuild that trust?
Well, trust isn't a new thing. Distrust isn't a new thing. That's been generational, and it's been generations of negative experiences. Mm-hmm. But I want to be clear that frontline staff care very deeply, and they want very much to improve the relationship between themselves and patients. Often, though, they're stuck within large systems that it's very hard for those systems to make changes and to pivot on anything quickly. Okay. So our goal is to give them tools so that they can look at things differently, ask a different question, push back a little bit very respectfully. But then those things, one step at a time, can actually make a change to the experience that patients feel. So your viewers would see a change in their office based on a provider saying, hey, we're going to do something a little bit different at the front desk. And then that extends all the way through the visit. So it does make a big difference if it's the frontline staff having ownership of this, being the ones to make those changes and implementations within their own practice.
And this conference is going to give them the tools to do that. You've got some breakout sessions, you've got something called a hackathon, right?
Yeah.
Explain what some of these mean, right?
Well, we very intentionally wanted this to be different than very traditional conferences where everybody sits and gets lectured at. So yeah, the entire morning is activities. So yes, they will do a hackathon. So it's based on real life case studies that they get to reimagine how could you make this case better with better outcomes. Okay. And our goal is almost always better outcomes for the patient and lowering the cost of care and making it less complicated. So that's one of our activities. And then we're going to wrap up with something very intentional to empower people and to keep the energy up. But the whole thing is starting at the very beginning with telling a story about how one simple question someone asked a provider has now impacted positively over 1,000 lives and built a whole different process.
And absolutely something so vital for the community that you're serving and everyone else as well. Now, I know that this is going to be a very powerful conference, but I also know it's going to be a very fun conference. Yeah. It sounds like you've got a party planned, Doug.
Absolutely, yes. We are partnering with the No Hate campaign. Mm-hmm. They are coming to Grand Rapids for the second time now. They're going to be at the Brewery Vivant. And
great venue.
Fantastic partners, fantastic venue. Mm-hmm. And so the No Hate campaign really began as this silent protest against what was Prop 8 out in California, but it has evolved into something that is really considered a silent protest against the discrimination that so many in the LGBTQ community face. And so we wanted to partner with them, allow these iconic photos to occur. Everyone can get one and, have some fun. We've seen these events have lines wrapped around the block. And so by partnering with Brewery Vermont, they are able to come in, sign in, have some drinks, have some food, and really just enjoy their time and camaraderie before they have their photo taken.
I love that. And talk about the photo that's being taken, so they know what to expect.
Right? So they recommend people wear white, because they have a award-winning photographer come in to do these, and they really make it a bright photo, and they put a piece of duct tape, if you choose, over your mouth, and whatever pose you choose to take. And so it is going to be $40 per person, and then $25 for additional people in that photo. It is ultimately a fundraiser for them.
Absolutely.
And so,
absolutely. I'm going to keep you on the spot, though. Could you the tape over the mouth? Speak to the meaning.
Yeah, I mean, that's really part of that silent protest, showing that at the end of the day, hate isn't going to win. And so, I've participated in one before, and I really think that it's a powerful message.
Yeah, I'm imagining seeing those photos of those all over social media, the day after. A lot of that message getting out.
They have thousands of them on their website, and it's amazing to look at them. And we actually have a local, someone from previously used to work for Fox 17, Jackie Blankenship. Her and her daughter, who are both pageant queens, are going to be there to also get pictures taken and interact with people.
I know Jackie well. What a great representative for you as well. So this is something we want to invite the community to. All of you listening, Healthcare Reimagined. That conference, as you heard, put on by the Grand Rapids LGBTQ plus Healthcare Consortium. It's happening May 1st, coming up soon. Grand Rapids Community College, all-day event. You can get the full schedule, the registration, all of that waiting for you, simply by sending an email. Right there, the email address on your screen will get you all the information that you need. If you need that email address, maybe you don't have a pen handy right now, we'll have a link waiting for you at fox17morningmix.com. Thank you both for the time this morning.
Thank you.
Appreciate it. We'll be right back.